Hey everybody! So you might have seen the headlines, over 3 million bottles of eye drops recalled, just in time for allergy season. And these are the generic brands that you find at major retailers like Kroger, Walgreens, and CVS. The reason for the voluntary recall was cited by the FDA as lack of sterility assurance. But what does lack of sterility assurance mean? Was the product contaminated? Is somebody that's going to use it have an issue? Are their eyeballs going to fall out or get eaten by a microorganism? We're going to answer those questions today. You might be asking, who is this guy and what does he know about anything? My name is Jason Lawhoon. I have almost 20 years as a quality control microbiologist, starting out in a lab, mostly washing dishes, working my way up to doing the actual testing, and now I manage the microbiology programs for a Fortune 500 company who, disclaimer, has nothing to do with this video. So first, the good news and what lack of assurance of sterility does not mean. It does not mean that the product was found to be contaminated. If during either the manufacturer or the FDA's testing it was found to be contaminated, they would have disclosed that and said specifically that it was a contaminated or adulterated product. They also didn't mention any adverse effects from people that happen to use these eye drops. So if you bought and used these eye drops, you don't have to worry that there was a confirmed microorganism that was detected in them. But that doesn't mean that there's no risk either. Here's why. Some people might wonder, well, if they tested the finished product and they didn't find anything, doesn't that mean the product's safe? Well, not necessarily. So manufacturers might make hundreds of thousands of units of these products a day and only test a small fraction. For instance, if a manufacturer takes a sample every 3 hours over a 24-hour period, that's only 8 samples. They might produce 100,000 units in that time. So that's a very small percentage of representative sampling to confirm that the products are safe. This is common industry practice. It's not every individual unit or bottle can be tested. The manufacturer has to prove that the process itself is under control and can produce the product of desired quality. In this case, sterile eye drops. So that leads us back to our original question. What does lack of assurance of sterility mean? Well, it could mean a lot of things. First, and most likely, is that the company didn't validate it that one or more of their processes ensured sterility throughout the entire manufacturing process. One common example of this is not validating your cleaning and sanitization or C&S process for the maximum possible length of the manufacturing campaign. They also need to prove that the environment or people don't have a possibility of contaminating the product. Pharmaceuticals, the manufacturer in this case, was actually given a warning letter in 2023 from the FDA for not validating one of their processes in studies called a smoke study as being effective. And what a smoke study does is show that the environmental air isn't coming in contact with your product at any step in the manufacturing process. There's a good chance that something related to that 2023 FDA warning letter is the culprit here, as the FDA always circles back and makes sure that those gaps that were previously identified and talked about are closed. Of course, there's always the possibility that lack of assurance of sterility means something else. For instance, it could mean that they didn't validate their test method and prove that it could actually pick up bacteria or microorganisms if they were present. This is normally called method suitability, where you actually have to prove you can detect microorganisms using your test method if they are present in the product. Along the same lines, they might not have proven that their water system was in control, free of bacteria, and that water system is used to both manufacture the product and clean and sanitize the equipment very oftentimes. So what's the risk? Well, when you're dealing with a sensitive area like the eyes, there's need for caution, and the risk certainly isn't zero. So that's the reason for the 3 million bottle recall. Even if a tiny percentage of those bottles are contaminated, you're talking about serious consequences possible for people that use those products, including loss of eyesight. There might be a very small chance of this, but it's happened before, and there's documented cases of it, and that's why the FDA takes it so seriously. Think about it. Would you want to be injected with medicine that's 99.9% guaranteed to be sterile? That's way too much risk. The same concept applies here. Every company needs to have control based off their specific product. The FDA is tough, but there's a reason why these controls are in place. If you want to learn more about that, watch this video here about how AI can potentially prevent recalls, and thank you for watching.